Hi, I'm Ali Hobeika, physician at Fertility Centers of Illinois. In this National Week on Infertility Awareness, we address our infertility community, acknowledging the struggles of infertility warriors, reinforcing our support to them, and spreading awareness and knowledge that infertility is a disease that does not discriminate by age, race, or other demographics. Today, we shed light upon the hidden soldiers that assist those warriors throughout their journey, our nurses. With no doubt, we could not provide what we provide if it wasn't for their support and dedication. I always say that they are our second halves, many times the better ones, spending a significant amount of time in direct patient contact. I am privileged today to have them with us and to discuss different aspects of their involvement in patient care. Ladies, hello, and thank you for taking your time to be with us today.
Hello.
Hello. Hi.
I'm going to start by introducing all of you to us. I'm going to start by Michelle first.
Hi, I'm Michelle. I work in the Tinley Park office with Dr. Hobeika and Dr. Ahmad.
Next, we'll move to Laura.
Hi, I'm Laura. I work in the Glenview office with Dr. John Rapisarda.
And last but not least, we go to Amber.
Hi, I'm Amber. I work in the Highland Park location with Dr. Allison Rogers.
So without any delays, we will start by a couple of questions. Michelle, you're the lucky one to start, so I will start with you first. You and I, as you mentioned, work together at the Tinley Park office, and you have been with FCI for numerous years now. Why the field of infertility, and what's so special about it?
What attracted me to the field was my own experience with fertility. I was always in women's health care. I worked gyne-oncology, labor and delivery, antepartum, postpartum, and so I'd always worked with women's health care, but I never considered doing fertility until I went through 2 years of fertility treatment, which was unsuccessful, and I adopted my first daughter. And then I switched over to fertility in 1990, which is about the time I adopted my second daughter. And since that time, I did go through more fertility treatment. One pregnancy ended up in a miscarriage, and then I conceived twin boys. So I think all of those things helped me to understand what most couples are going through. So I think, it gives me a little more empathy and compassion for the patients that are going through fertility treatment.
Nice. Amber, how do you define the role of a nurse at the Fertility Centers of Illinois throughout the infertility journey of a patient?
I would describe the fertility nurse as the organizer, as the person that helps you get through the process. You don't necessarily know what you don't know when you start fertility, and we will help gather that information for the physician to decide on, or help you decide on what type of treatment to pursue, and then we'll be with you every step of that journey in organizing and making sure all your medications are ordered, in talking to you after each appointment that you have and what your next steps are going to be so that you can always anticipate what is coming next, and in celebrating when you finally get that positive.
Great. Laura, with that being said, what do you believe is the most important asset of a fertility nurse?
I think a fertility nurse should be approachable. I like to tell my patients that it's my job to learn how you think, meaning are you detail-oriented? Are you very nervous? Are you apprehensive about, coming into for medical care as a patient? Whatever it is, I think that will help in terms of modifying or adapting our care to the specific needs of the patient, so that it's a very unique experience for each patient.
I see. Amber, similar to Michelle, you've also been a patient and a nurse as well. During your journey, what were you looking for specifically in your fertility nurse?
Well, I was very privileged to have such a great team on my side, knowing the nurses personally. But I can tell you that what I would look for in a nurse would be someone who's organized and efficient, a good communicator, and someone who's truly invested in your journey.
Nice. Laura, you've been with FCI for a number of years now. And what's special in your career is that you spend the majority of years working with one specific physician. How did the needs of patients change over time since when you started until nowadays?
I started in the early 90s. There was no internet per se in terms of the availability we have now. So patients are much more knowledgeable now because of the internet, because they can do somewhat of their own research. On the other hand, there's Dr. Google, which sometimes patients will come in with information that's not necessarily accurate. So it's my job to kind of help them. You know, sometimes they have very good information, but other times we have to kind of learn, educate them in terms of what is a little off in their knowledge. That's a big difference than before.
Thank you. Michelle, going back to you, what was also special about your long career with FCI is that you have worked with various physicians over time. How did your role change along those years working with different physicians?
I worked for a wonderful physician for 20 years. So that was my longest career with one physician. To now, I worked with 4 physicians in the last 7 years. So it's been an interesting change for me. Back in the earlier days, it was in the 90s when we had to do paper charting. So that was interesting. Now we do electronic charting. So that has speeded things up quite a bit. As far as working with the newer physicians, I think that it's an experience for both of us. You know, it's been a collaborative effort for both of us on both our ends for learning new information from one another. Newer physicians have come out of school with, you know, more knowledge and newer knowledge, I should say. So I think that that's been a great experience for me.
Laura, I'll end with you by asking you, since you also have worked with other practices in the past, what makes a fertility nurse at the fertility centers of Illinois so special from a nurse who works in infertility in other places?
I really feel that because we are your primary nurse, we give, you most often will work just with one nurse, that personalized care sets us apart. And as well, obviously, you're working with the physician. Your physician nurse are a team of caregivers to you as a patient. And the fact that you're not just a number, so to speak. You're very much an important patient to your doctor nurse. That's what I would say.
So thank you, ladies, for being with us. Any last words you want to add?
We are so excited to work with you. It's your miracle and our mission.